Hi, my name is Toby Hunter, and I'm a nurse practitioner with the Regional Anesthesia and Acute Pain Management Service here at the VA in Palo Alto. So you're having surgery today, and we're going to place a nerve block for you. A nerve block is a procedure where we inject some numbing medication around your nerves. By injecting numbing medication around the nerve, we're able to prevent the nerve from sending pain signals up to the brain. This helps to manage your pain and also helps to reduce the amount of opioids you need after surgery. Reducing opioid use helps to reduce opioid-related side effects, including dizziness, shortness of breath, and constipation. Nerve blocks are generally very safe procedures and very beneficial. So in the pre-op area, before you go into surgery, we'll go ahead and place the nerve block. The nerve block catheter is a very thin, flimsy tube. It's about the size of angel hair pasta. This is what houses the numbing medication. So it's a two-level ball. The outer bag has no medication in it, and the inner bag is what actually houses the numbing medication. You won't see a change in the size of the pump until about 24 hours after we start the infusion. Over time, the outer bag will get flat and the inner bag will get smaller as the pump runs out. After the pump is empty, this is what you will see. You will see a flat outer bag with a cylinder in the middle. Once you see this, that means that we don't have any medication in the system and it should come out. The system also has a clamp. The clamp is your on and off button. To turn off the clamp, you push down and that system is off. Once you open the clamp, you just pull the lip up. Reasons to turn off the clamp include feeling too numb. If you feel too numb, you can turn off the clamp for a few hours until you start to have some tingling. Once you start having tingling, you should turn the clamp back on and allow the medication to run before your pain kicks in. Another reason to turn off the clamp is if you feel like your pain is well controlled and you would like to take out the system. If your pain is well controlled, you should do a clamp trial. Doing a clamp trial allows you to experience your pain without the numbing medication. You would turn the clamp off for 5 hours. After 5 hours, if your pain is still well controlled, go ahead and take out the system. If your pain has increased, you may want to unclamp it and give yourself another day. This is how we set the dose. Please do not change the dose at home. We want to make sure that the dose is safe for you. This is your on-demand button. You can give yourself additional boluses of the numbing medication up to every 30 minutes. To use this, you press the button like so. The button usually pops up within 1 minute. Sometimes it can take up to 30 minutes. If the button pops up, we are certain that the system is working. The system is working properly. This window is our indicator. The orange line at the window will be at the top whenever this button is prepared to be pressed. Please check the window to make sure that the button is ready before giving yourself an extra dose. After surgery, we will connect the system to your nerve block. Once the system is connected, please do not disconnect it until you are ready to remove the nerve block. This is very important to prevent infection. If you disconnect it, it's possible that you can expose bacteria to the system. When you are ready to take it out, you simply begin by removing the tape at the bottom of the white patch, and you remove all of the tape. So pull the corners of the tape up. Once all of the tape is removed, you can remove the catheter. All the tape is removed, and now I will remove the catheter. And once the tape is removed, usually the catheter comes out with it. Sometimes a catheter may be under your skin, about 10 centimeters, so you might have to pull out a little, but it should be a gentle pull. The end of the catheter should be black. The black tip confirms that the entire catheter was removed. If you have any concerns about the black tip not showing, please call us. We will send you home with this patient education pamphlet. Read it on your free time. It has a lot of information and will answer most of your questions. If you have any questions or concerns and you need to reach us immediately, please call this phone number. It is the main hospital number. When you call, ask to speak with the regional anesthesia provider. Your hospital operator should be able to page the pain management team, and we will be able to answer or address your concerns. If you don't have any concerns that need to be addressed urgently, we will call you at home every day until the nerve block is removed. If you stay in the hospital, we'll see you in the hospital every day until it is removed. There are very few complications, but there are a few safety tips for patients to know. One of our major concerns is injury to your surgical arm or leg after surgery. If you have a nerve block for arm or hand surgery, we'll likely place it here, just below the clavicle. And usually, your arm will be numb pretty much from your forearm down to your fingers. What can happen is that you will have some weakness in your arm from the nerve block, and so your arm may swing around a little. To prevent this, we would like you to wear a sling. This will prevent you from accidentally hitting the surface and injuring your arm. If you're having a foot or ankle procedure, you will likely be numb below your knee down to your toes. For these type of surgeries, it's very important that you use crutches or a knee scooter. This will help prevent falls and injuries to your foot. Another concern is thermal injury. The major concern here are burns or injuries from ice. So please avoid heat therapy while you have a nerve block in place. If you're using ice to help with your pain, keep the ice on for 20 minutes at a time. This will help to prevent any injury from cold therapy. Patients at home should also monitor their site for infection. Monitor daily for redness, swelling, or pus. If you notice any sign of infection, go ahead and remove your catheter. Very uncommon to have infection, but it's nice for you to be aware. Another very uncommon complication of nerve blocks is local anesthetic systemic toxicity, LAST. What people may experience is numbness in the mouth, ringing in the ears, or a metallic taste. If you experience any of this, turn off your pump immediately and call us. Please notify us of this. The nerve block will usually last about 3 to 5 days. This depends on how often you use the on-demand bolus button. If you press this button often, the pump will last closer to 3 days. If you don't press it at all, you will likely be able to keep the pump for 5 days. We expect that you may need other pain medications while you have the nerve block in place. The nerve block does not always take away all of your pain. It is not unusual to require additional oxycodone or Percocet or hydrocodone or Norco. It is safe to use your opioid pain medications with the nerve block. Some people may also have what we consider a failed block. This is when the nerve block does not manage their pain or does not work properly. If this occurs, we will expect that you will just manage your pain with your pain medications and likely remove your nerve block. We look forward to answering any of your questions or concerns about the nerve block.